Welcome to the Preventive Medicine Podcast. Help us change the paradigm of medicine from keep people alive to help people thrive, one episode at a time. And now, here's the show.
So kind of on that same front, particularly with your work with WebMD, do you notice sometimes it's difficult to balance the idea of people Googling their symptoms and self-diagnosing versus using these platforms as they're designed to kind of better inform them and find information about topics they like? But it seems like sometimes we have to kind of worry about that aspect of things as well. What do you think about that?
Yeah, everyone has Dr. Google. Everybody has this in their pocket. I go to it at times. So, my goal at WebMD is to make sure that we have good content out there and that, we have 80 million page views a month. When people search on Google, we're usually number one or number two in search 95% of the time. So people are going to come to our site. But what we're also trying to do is to recognize, you have to know the trends and realize when, you're not going to change it. So people want to search and, 5 years ago, people would search rheumatoid arthritis online. They print it all out and they bring it to me and, we put it to the side and just do whatever we want. Now we want to have a discussion and that's a good thing. I'm okay with that. But we have to recognize that, online. So what we're saying is search is changing because they search content, but then they want care. So how do we help them do that? So you search knee pain, you think you have arthritis, it's probably DJD, but maybe you think you have rheumatoid arthritis. You want to see a rheumatologist now, right? Why should you have to wait in the morning to call your doctor? So we can help arrange a telemedicine visit. We can help you know who the rheumatologist in your area. If you search STD symptoms on WebMD, depending upon the state that you live in, we can give you a pop-up or another type of notification that will allow you to get STD testing. You can talk to a doctor online. A lot of people prefer that anonymity, and you can get tested. It's the same thing in some other areas. A lot of folks they don't want to wait to see a dermatologist. In some areas of the country, it can take a while. So you might be able to, snap a picture. There are some challenges, and even now with the good cameras, because distance matters and how you shoot a lesion. But you know what? You might be able to do telederm and at least get a preliminary read. So we have to recognize there's also this DIY, what I'm calling in healthcare. People want to be their own doctor, and that has some drawbacks. But if we don't respond and give people opportunities to talk about it to their doctor, that's going to be a challenge. And that's the biggest way that search has changed. So I get it. People, it's on coronavirus too. You want to search symptoms and then you think you have it. And maybe you're right and maybe you're wrong, but we shouldn't remove the physician from the equation. And that's a big focus of ours. We still want to keep the physician involved because we want folks to get the best care. There's a reason why we go to medical school, and spend many years in training post-medical school.
Yeah, I think one of the running memes or jokes is that you go to WebMD and then everyone comes through with a diagnosis of cancer.
That's not true. They've been saying that for years. I don't hear that as much anymore. And we did revise our symptom checker. Yeah, I haven't heard that so much. I'm kind of disappointed in you. But yes, I've heard that. Yeah, a few times. Yeah.
So I think one of the challenges is kind of when you go to these websites like WebMD and you're using them that provide a lot of value to patients, but they're still kind of more obviously evidence-based and scientific. And when you have a website like that that's providing maybe a little bit more nuanced data or suggestions, and they see someone that's promoting their content on social media that has something completely different that's selling it very well. I think that's one of the problems that we see today where you were talking about how there's a lot of these other voices that are maybe misinforming people or giving them a very, very bad idea or maybe pushing them towards other theories of medicine. I think those people tend to have a louder voice, which is why I think what it comes back to is that communication that you were mentioning for physicians and just being able to be there for the patients and being able to put yourself out there and communicate. So I think WebMD does a fantastic job at that.
Some of it is the power of storytelling. And we tend to talk in data and use words that people don't know. And what do some of these other voices do? They tell their own story, which may or may not be representative of most. But you know what? I can listen to that. Look why Jenny McCarthy was, in many ways got a lot of traction on anti-vaccine movement. She told the story, of her child. People are going to listen to these stories. And we don't often communicate well. We often don't know the power of storytelling. There's many areas on our site that are blogs where people can tell their stories. They're very popular, and we have to learn some of those, health strategies as well.
Mm-hmm. Moving forward with that, WebMD is one form of technology, but there's so many different other aspects that technology is changing healthcare. So what do you think the role is for technology and physicians using technology and delivering care? Because you mentioned telemedicine. We have all these websites like WebMD, which is like at the leader of doing that. But then I also saw somewhere online while I was searching for what you've done that you're interested in AI. So what is like the role of technology moving forward, and where do you see technology helping physicians in the future?
Sure. And that's where, we have to recognize trends and respond to them. So I'm very interested in digital tools. So we have to figure out how to use them effectively. So, there's a lot of tools, as there's Fitbits, there's others in terms of how patients can track information. But the challenge that we're having is I don't necessarily want more data points when you come to see me unless they're organized and they're structured. I don't want a lot of unstructured data. And that's how a lot of information is now from consumers. I'd rather it's either plotted out in trends over time or give me what the variance is in terms of your blood pressure or heart rate or whatever. I don't necessarily need to see your food diary, but I'd like to see some components of micro and macro nutrients. So the digital tools there are going to, they're here to stay, and we have to figure out how to use them effectively. Some of it is this lack of unstructured data, but I think we're going to make changes in that. Telemedicine, it is up probably 80%, at least, more than that. The problem is it was very small to begin with. So how do we help utilize that? Telemedicine and telehealth are here to stay post-COVID. We've seen their role, but they're not going to be the majority of patient visits, over the next couple of years, maybe over time, but I don't think we'll be at 50% a year from now, just because there's still a role to come in. And then what's the role of AI? And a lot of physicians are scared of AI, and they'll say, well, we're not going to need radiologists anymore, and we're not going to need, some aspects of cardiology. But for those of us that are very interested in it and involved with it, we really say that AI is not going to replace physicians, but AI is going to replace physicians who don't use AI in their medical practice. So we like to think that we're the best, predictors of things, but there's a role of artificial intelligence. We've seen that in terms of diabetic retinopathy, that they can look at these scans and they can do it better. Eric Topol is a big proponent of artificial intelligence. He talks about how, I can use AI to tell whether a human eye is male or female. And if I ask just, 100 physicians, actually only 50% will get it right. That's luck, right? AI can predict it through looking at, thousands of things, with 95% accuracy. Okay, but I don't know if that's relevant in clinical practice.
Yeah.
Does that really matter? But if it's able to look at subtle changes and multiple factors and tell me whether this person is at risk for lung cancer, that's a concern. If they can look at these huge databases and be able to more effectively tell me what are the predictors, whether or not they're going to return to the ER, rather than looking at 7 criteria that we typically look at, that has value. So we need to embrace AI. I know a younger generation of physicians are more receptive to that, and the older ones are kind of not necessarily fearful, but a little distrustful. It's here to stay. I think the challenge has been people will say AI will make our lives easier. And for those of us that are older, we'll say, that's what they said EHRs would. EHRs are going to make our lives easier. It did. But, now AI is going to make my life easier. It's just going to make my life harder. It's going to add more work. But we have to embrace technology. It's here to stay. And for those that don't, they're going to be swept aside. So I'm a big proponent of how do we use AI, how do we use all these great digital tools. But simply because we can measure something doesn't mean that it's going to be useful for our clinical practice. But I think in the field of preventive medicine, it will be great. AI could, be very helpful in terms of understanding, what are the right predictors and risk factors to really improve, cancer screening, to provide us better tools to help people, lose weight. I don't want to do all that tracking that you're doing. And, it can help me understand what are the right exercises for me, right? It's all about personalized medicine. It's all about precision medicine. That's really the term that the FDA and others like to use.
And one thing I've heard that I really like is it's almost liking the idea of if you take someone who's a really good race car driver and you put them in a better car, they'll be a better race car driver. Yeah. So I think, if we look at it from that scope and you take doctors who are very well trained in both medicine and adequately trained with technology, I think that you improve patient outcomes. You probably will end up removing a lot of clerical error, physician error that just happens. And I think AI can almost be a safety net for us in a certain way. And that can be really beneficial for us in the long term and to the patients in the long term.
Right. No, I think it's right. And, the challenge has been, again, in this collection. So I'm sure you get a lot of notifications on your phone as well. I don't necessarily want a gazillion notifications when I log in. I do my clinical time at Kaiser, on Epic. Some of those could be lower level practitioners who could automatically be rerouted to them rather than for me to have to look at, prescription reorders or patients calling the call center. Everything doesn't have to be determined by a higher level practitioner. And we need to figure out those strategies as well.
Preventive medicine is an incredibly important topic. I want to thank you for taking the time to watch this video. For the full episode, find us on your favorite podcast streaming platform. If you enjoyed this video, don't hesitate to hit that subscribe button, like this video, and share it to keep that message spreading. Thank you once again for watching this video, and we'll see you in the next one.